After having assessed cardiac shadow, cardiac size, chamber enlargement, major and minor vessels in the thoracic cavity, we will concentrate now on the pulmonary patterns. It will help us a lot in narrowing the differential diagnosis possible with many different cardiac and respiratory pathologies. A normal lung pattern consists of a vascular pattern where we can see the normal blood vessel structure. Pathological patterns are bronchial patterns, alveolar patterns, soft tissue patterns, mineralized densities in the chest cavity, and interstitial patterns. However, we have to be very careful with over-interpreting interstitial patterns, because just the fact that the radiograph is taken in an expiratory phase can give you an interstitial pattern. So it's very important before deciding on the presence of an interstitial pattern that we are absolutely sure that the radiograph is end-inspiratory. A pulmonary bronchial pattern is characterized by thickening of the smaller airways, which is visible on thoracic radiographs by little donut signs or trem lines. And occasionally we can even see dilation of the larger airways, which is called bronchiectasis. It indicates, in most of the cases, bronchial disease like chronic bronchitis, eosinophilic infiltrates of the bronchi, and the pulmonary parenchyma, and many other respiratory diseases. It is not characteristic for heart disease. Interstitial pulmonary patterns are characterized by a loss of vascular structure in the parenchyma, with a hazy honeycomb structure as well in the different lung lobes, and can be as well respiratory as cardiac in origin. The respiratory causes for interstitial infiltrates are numerous, whereby interstitial pulmonary fibrosis infiltrate with non-cardiogenic pulmonary edema, as well as just fatty and neoplastic infiltrate can give this type of images. However, if we have to deal with interstitial infiltrate secondary to left-sided congestive heart failure, the infiltrate will be localized mainly in the perihilar area. Once it goes to the rest of the lung lobes, we very often have to deal with a more alveolar pattern. Alveolar patterns indicate that the whole alveolar space is filled with fluid. This fluid can be edema, cardiogenic or non-cardiogenic, but also pus or blood, like we can see with intrapulmonary hemorrhage or with aspiration pneumonia. The characteristic of an alveolar pattern is a complete loss of vascular structure with the leftover of an air bronchogram within the pulmonary parenchyma. Cough is probably the major symptom of our cardiac patients with mitral valve disease, and it will also be an occasional presentation of the larger dog with dilated cardiomyopathy. However, the big misunderstanding up to date is the fact that these dogs are coughing because they have pulmonary edema. Some of them will, mainly the large breed dogs, but most of these dogs, mainly the small dogs, are coughing because their enlarged left atrium is causing left mainstem bronchus compression, and this mechanical compression is the trigger of the cough. However, many of these small bleed older dogs have concurrent respiratory disease, and it's not because there is presence of a heart murmur and some left atrial enlargement that the cough is also purely cardiac in origin. It is therefore essential to make chest radiographs in every dog that is coughing to see if the reason of the cough is purely cardiac, respiratory, or many times a bit of both.